Benefits of a good lesson plan for teacher. Benefits of good lesson plan for teacher. A well-structured lesson plan offers several important benefits of a teacher, especially in education and clinical teaching context, such as nursing education. A clear lesson plan helps the teacher maintain focus and direction throughout the teaching session. It defines what should be taught, how it should be taught, and what outcomes are expected, reducing the chance of missing key content. It improves time management, allowing the teacher to allocate appropriate time to each topic, activity, and assessment. This ensures that the entire lesson is completed within scheduled period without rushing or overextending. It increases teaching confidence and preparedness as the teacher enters the classroom with a clear roadmap. This reduces anxiety and helps the teacher handle questions and discussion more effectively. A good lesson plan supports better classroom control and organization. When activities are planned in sequence, student engagement becomes smoother and transition between topics are more controlled. It enhances teaching effectiveness and clarity, making it easier to deliver content in a logical, structured, and student-friendly manner. This improves student understanding and retention. It allows follows for flexibility and adaptation because the teacher can anticipate potential difficulties and prepare alternative strategies or examples in advance. Another key benefit is evaluation and improvement of teaching practice. A lesson plan provides a reference point for self-assessment, helping teachers identify what worked well and what needs modification in future section. Finally, it supports continuity in curriculum delivery, ensuring that each lesson connects properly with previous and future content, maintaining overall coherence in the course. Benefits a good lesson plan. For student clinical benefits of a good lesson plan for a student according to in nursing education, a well-structured lesson plan directly improves student learning outcomes by providing clarity, direction, and meaningful learning experiences. The key benefits for students include a good lesson plan gives students a clear understanding of what they are expected to learn in a session. When learning objectives are defined in advance, students can focus their attention on essential concepts such as clinical procedures, patient care principles, and theoretical foundation without confusion. It improves learning organization and continuity. Nursing subjects often build on prior knowledge, and a planned lesson ensures smooth progression from basic to complex topics, which strengthens long-term retention and clinical reasoning. It enhances active participation when teaching methods such as demonstration, group discussion, simulation, or case-based learning are planned properly. Students become more engaged and are able to connect theory with real clinical practice. It supports better preparation for clinical practice. A structured lesson helps students understand step-by-step procedure, patient safety measures, and evidence-based practice, which improves confidence during hospital rotations. It reduces learning stress and confusion. Predictable structure and clear guidance help students follow lesson more easily, especially in complex like pharmacology, medical, surgical, nursing, and maternal health. It promotes critical thinking and decision making. A good lesson plan in nursing education often includes problem-solving activities and clinical scenarios that train students to analyze patient condition and make appropriate nursing decisions. It ensures effective use of learning materials and time. Student benefits audiovisual aids, demonstrations, and clinical tools are used purposefully rather than randomly making learning more efficient. Overall, a strong lesson plan creates a structured, student-centered learning environment that improves understanding, clinical competence, and professional readiness in nursing practice. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Teaching technique according to nursing education. Teaching technique according to nursing education. Teaching technique according to in nursing education, teaching technique refers to the specific methods, strategies, and procedures used by a nurse educator to facilitate learning and achieve defined instructional objectives in cognitive, affective, and psychomotor domains. Definition: teaching techniques are practical ways of delivering content and guiding learning experiences so that nursing students can acquire knowledge, skills, and professional attitudes effectively. Common teaching technique in nursing education: lecture method, a structured oral presentation of content by a teacher, useful for large groups, efficient for theoretical knowledge. Demonstration: showing a clinical skill step by step for students to observe and learn. Highly effective for psychomotor skills, example injection tracing, discussion method, interactive exchange of ideas between teacher and students, encourages critical thinking, develops reasoning skills, simulation technique, use of modes, mannequins or virtual tools to imitate real clinical situations, safe practice environment, builds confidence before patient care, case study method, analysis of real or hypothetical patient situation, develops clinical judgment, integrates theory with practice, role play students act out clinical or communication scenarios, improve communication skill, enhances empathy and understanding, bedside teaching, teaching directly in the clinical setting with patients, strong clinical correlation, improves practical decision making project method, students work on assigned topics or health problems, encourages independent learning, develops research ability. Summary teaching techniques in nursing education are systematic approaches used to transfer knowledge, develop clinical skills, and shape professional behavior, ensuring competent and safe nursing practice. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah Rabbi min kulli dhanbi wa atubu ilayh. আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন। Preparation of a classroom as a nurse teacher. Preparation of a classroom nurse teacher according to doctor's order. According to nursing education. According to nursing education. Preparation of a classroom as a nurse teacher according to nursing education. Preparation of a classroom as a nurse teacher according to nursing education. In nursing education, preparing a classroom is considered a structured pre-teaching activity that ensures effective learning, especially in clinical and theoretical instruction. Preparation of a classroom as a nurse teacher, physical environment setup. The nurse teacher ensures the classroom is conducive to learning, clean, well ventilated, and adequately lit room, proper seating arrangement, U-shaped, semicircle, or group clusters depending on method, availability of teaching space for demonstration and movement, temperature and noise control for comfort and concentration, instructional materials preparation, arrange whiteboard or blackboard and markers or chalk, prepare audiovisual aids, slides, videos, charts, models, ensure availability of mannequins or simulation tools if needed for nursing demonstration, check projector, computer and internet connectivity if required, Learning objectives alignment, clearly define cognitive, affective, and psychomotor objectives, ensure content matches curriculum and student level, organize content in logical sequence, simple to complex, student readiness, check attendance list and ensure student participations, readiness, review prerequisite knowledge through questioning or quick revision, encourage motivation and set learning expectation, teaching strategy planning, select appropriate teaching methods lecture, demonstration, discussion, simulation, case-based learning, plan timing and interaction points during the session, prepare questions for evaluation and reinforcement, safety and infection control, clinical relevance, ensure safe classroom environment, especially for skill-based teaching, clean and disinfect teaching equipment if shared clinical tools are used, maintain proper handling of medical models and instruments, classroom management preparation, establish rules of for discipline and participation, plan seating to reduce distraction and improve interaction, prepare for group activities or skill station if required, evaluation preparation, prepare short quizzes and oral questions or checklists, arrange feedback tools to assess student understanding, summary. A well-prepared classroom in nursing education ensures effective knowledge transfer, skill development, and professional attitude formation by creating a structured, safe, and learner-centered environment. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় সফলতা দান করুন। Micro teaching according to nursing education. Micro teaching according to nursing education. Micro teaching according to nursing education. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। Micro teaching in nursing education is a controlled, scaled down teaching practice technique used to develop and refine teaching skills among student nurse or nurse educators. It allows the learners to teach a small content segment to a small group of peers for a short duration, usually 5 to 20 minutes, focusing on specific teaching behaviors. Definition: Micro-teaching is a teacher training technique in which a prospective nurse educator practices a short lesson in a simplified classroom setting, receives structured feedback and reteaches after improvement. Key characteristics: small teaching unit, one concept or skill, small audience 5 to 10 learners pairs, short duration 5 to 20 minutes, focus on one teaching skill at a time, example questioning, explanation, reinforcement, immediate feedback and reflection, opportunity for reteaching, steps of micro teaching style, cycle, planning, prepare a micro lesson plan, teaching, deliver the lesson in a simulated setting, observation, supervisor or peer observe performance, feedback, constructive critique is provided, replan, modify teaching based on feedback, reteach again with improvements, core teaching skill develop, introduction skill, explanation skill, questioning techniques, stimulus variation, voice, movement, AV aids, reinforcement, positive feedback, closure skill. Advantages in nursing education: builds teaching confidence in nurse educator, improve communication and presentation skills, allows safe correction of teaching errors, enhances classroom management ability, promotes reflective practice, bridge theory practice base a gap in nursing instruction, limitation artificial classroom environment, limited interaction with a real patient student, time consuming due to repeated cycles, may not reflect real clinical teaching complexity. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah Rabbi min kulli dhanbi wa atubu ilayh। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Peer assessment according to nursing education. According to nursing education, peer assessment according to nursing education. Peer assessment meant according to nursing peer assessment in nursing education. Peer assessment refers to a structured educational process in which nursing students evaluate the performance, skills, or competence of their fellow students based on predetermined criteria. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Definition in nursing education: peer assessment is a formative evaluation method where students judge and provide feedback on each other's clinical, theoretical understanding, communication abilities, or professional behavior using standardized tools or checklists. Key features involve student assessing student of similar level, uses clear criteria, rubrics, checklist, rating scales, focuses on both performance evaluation and constructive feedback, commonly used in classroom simulation labs. Purposes in nursing education: enhances critical thinking and clinical judgment, promotes reflective learning, develops evaluation and observation skills, encourage active learning and responsibility, improves communication and teamwork skills. Advantages: immediate and diverse feedback, builds self-confidence and accountability, reinforces learning through evaluation of others, reduces teacher Workload in large groups, limitation, risk of bias or personal conflict, inconsistent judgment among students, limited objectivity without proper training, possible discomfort among peers. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم استغفر الله ربي من كل ذنب وأتوب إليه. Non-formal education according to nursing education. Non-formal education according to nurse midwife. Non-formal education according to nurse midwife. Education according to nurse midwife. Nursing education. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Non-formal education in nursing education refers to a planned, organized, and systematic educational activity that occurs outside the formal academic school or university system, but is designed to improve knowledge, skills, and competencies in nursing practice. Key features: a structured but flexible, no rigid curriculum like formal education. Goal-oriented learning, usually short-term or skill-based learning, can be certificate or competency-based, competency-focused, often conducted through workshops, seminars, continuing nursing education in service training programs, community health education session in nursing context, non-formal education help nurses update clinical skills and knowledge, improve patient care quality, learn new technologies and procedures, develop professional competence outside degree programs. Hospital conducts a workshop on infection prevention and control for staff nurses. This is a non-formal nursing education. If you want, I can also compare formal, non-formal, and informal nursing education in a table for exam preparation. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم استغفر الله ربي من كل ذنب وأتوب إليه. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। It's okay. Workshop. Workshop according to nursing education. Workshop according to nursing education. A workshop in nursing education is a structured short-term, intensive teaching learning activity in which learners actively participate in acquiring knowledge and developing specific clinical or professional skills through discussion, practice, and hands-on experience. Definition: a workshop is a goal oriented educational method where a small group of learners work together under expert guidance to gain practical competence in a particular nursing topic or skill. Key features: learner centered approach, active participation, and hands on practice. Small group interaction, focus on a specific skill or problem, guided by a facilitator or subject expert, combines theory with practice. Objectives of workshop in nursing education: to develop clinical skills and competencies, to enhance critical thinking and problem solving ability, to bridge the gap between theory and practice, to encourage collaborative learning, to update knowledge on specific nursing procedures or topics. Steps or organization of a workshop: planning stage, selecting topic, objectives and participants, introduction, session orientation and briefing, demonstration expert shows the skill or procedures, practice session participant perform the skill, group discussion or feedback, reflection and clarification, evaluation, assessment of learning outcomes, advantages, promote active and experiential learning, improves psychomotor skills, encourages teamwork and communication, enhances confidence in a clinical practice, makes learning more practical and effective. Conclusion: in nursing education, workshops are highly effective teaching strategies that transfer theoretical knowledge into practical clinical practice competence, preparing students for real healthcare settings. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দিয়েন। টাইপস অফ এডুকেশন: education according to nursing education. Types of education according to nursing education. Types of education according to types of education according to nursing education. In nursing education, types of education are commonly classified in a few standard ways depending on purpose, structure, and learning setting. Formal education: this is a structured, systematic, and institution-based learning, follows a fixed curriculum and syllabus, leads to recognized qualifications, certificate, diploma, degree, has clearly entry requirements and evaluation system. In nursing: diploma in nursing science and midwifery, BSc in nursing, MSc in nursing, PhD in nursing. Non-formal education: this is in organized learning outside the formal academic system, flexible in time and place, usually short-term and skill-focused. No strict grading or degree awarding system in nursing. In-service educational programs, workshop and seminars, CPR training, infection control training session, continuing nursing education programs. Informal education, this is just unstructured lifelong learning gained through experience. No fixed curriculum or institution, occurs naturally in daily life and clinical practice based on observation, experience, and interaction in nursing. Learning clinical skills from senior nurses, gaining experiences from patient care situation, learning communication skills in the work environment, continuing education, professional nursing education, a lifelong learning process to maintain upgrade professional competence. বলেন মোবাইল এরকম আছে কেন